This is Eye on Health,
delving into your overall well-being
with MedLab Middle East
on Dubai Eye 103.8.
Great to have you with us. I'm Helen Farmer and you are listening to Eye on Health here on Dubai Eye 103.8, brought to you by MedLab Middle East. We're talking about sustainability in healthcare today, and in conversation with Dr. Rana Nabulsi. She is a consultant in healthcare technology and innovation, the head of quality in the pathology department at Dubai Academic Health Corporation. What we need to know about what's happening behind the scenes, which very much brings us to today's topic. According to data from the non-profit organisation My Green Lab, medical laboratories consume 10 times the power and 4 times the water of commercial office spaces and generate an average of 5.5 million metric tonnes of plastic rubbish annually. With these numbers, the healthcare industry is under huge pressure to redesign old laboratories, optimise practices, address energy consumption, and of course recycling with a particular focus on plastics. But changes are already being made. But how much still needs to be done? We're finding out now with Dr. Rana Nabulsi. She is a consultant in healthcare technology and innovation, the head of quality in the pathology department at Dubai Academic Health Corporation. Dr. Rana, thank you so much for being with us today. I find it really fascinating to think about the hard work and research that's being done behind the scenes, obviously for the betterment of patient experiences, but also with the planet, which I think brings your expertise really, really nicely together. And I wondered if you could give us a little bit of a background on laboratories of your time and perhaps how much they've changed over the decades. Can you paint us a bit of a picture of what a typical lab was like when you first started your career?
Thank you so much, Dubai Eye team, for this opportunity. Actually, in fact, climate change is a global emergency and responsibility that goes beyond national borders. And clinical laboratories are consisting of more than 70% of diagnosis in healthcare. So hospitals and healthcare systems cannot really survive with testing, laboratory testing. So when it comes to sustainability practices, in Europe, healthcare in general is responsible for 5% of European greenhouse gas emissions. And in US, the healthcare sector accounts for more than 8.5% of US emissions. So as you said, the medical labs at the global level are consuming between 5 to 10 times more energy than office spaces. In addition to this, we are spending 5 times water per square feet than office spaces and responsible for 5.5 million metric tons of waste per year. Accordingly, we need to work hard at the global level for all diagnostic and medical laboratories to build sustainability in our practices and to reduce the carbon emission and to save the environment.
So tell us about a typical lab that you started working in at the beginning of your career, Dr. Rana, and perhaps how much things have changed in terms of what would be in a space, but also the practices now in 2022.
Yes, and Dubai Academic Health Corporation and DHA, we completed the strategy of paperless practices as per the initiative of Dubai government, and it was a big milestone for us. In addition to this, we are in an extensive project of consolidating the testing. We have 36 laboratories in 4 hospital labs, Dubai Genetic Center, Blood Donation Center, and we have a primary healthcare center as well. So all labs are scattered everywhere. So in order to optimize the consolidation and the sustainability practices, we are centralizing the testing. We are sharing equipments, machines. Not only this, we are encouraging our staff for carpooling and using public transport rather than they have their own vehicles coming to the work. We are focusing on switching off policy of machines overnight. In addition to this, we are looking into policies to have a green inventory in our lab for better supply chain and better logistics to save the environment. In addition to all of this, we started reducing the working hours of energy-intensive equipment, such as biological safety cabinets and a fume hood. At the end of the day, reducing and recycling and reusing machines, chemicals, and sharing it between different labs is a big impact on improving sustainability, reducing waste, reducing energy, and protecting our environment for future generations.
Doctor, how difficult has it been to implement those changes?
At the beginning, we faced many challenges. First of all, people think that sustainability in laboratories is just switching off the electricity and reducing water. This is really not true. They don't have the full awareness picture of how sustainability can be built in the lab. It is environmental, it is social, it's governance. It's not just carbon footprint. It's the electricity and dewables. It's more than this. So the awareness was a big challenge for us. In addition to this, how to measure the improvement of implementing sustainability practice was a challenge, because measurements is not easy to turn all these into carbon tons. In addition to this, tracking and the target setting was a little bit obstacle, but we are working hard on it to standardize it and share our practices with the private sector for the right awareness among other stakeholders in the community of Dubai.
So how are you measuring it, and what have the results been so far, Dr. Rana?
At the beginning, we started measuring the dewables, the consumptions of water and electricity, and then since we moved to paperless strategy, we are measuring the reduction of utilization of papers. And now we started measuring new KPIs when it comes to how much we recycle the hazardous material in the lab, like xylene and formalin. And we have many KPIs to be formulated, but still we need to turn them into a carbon footprint in order to be standardized with other industries worldwide.
And how does this compare to what's happening worldwide in other labs? Is Dubai, at the forefront, or are we learning from other countries who have already adopted different practices, do you think?
I think the sustainability in clinical laboratories is a new trend. Most labs have to get and formulate strategies and action plans to reduce their impact on the environment. We are learning, still we are at the beginning, but definitely you can see some labs in Dubai is doing it and they are following the European examples of laboratories in Europe. And definitely it's a journey. We started recently, but I am sure we will all optimize the sustainability for a better future.
Looking to the future then, what would your hopes be? What could a lab of the future look like, do you think?
First of all, as we mentioned before, the lab should feel the responsibility. It's a global crisis coming. And since we are at the healthcare, we participate between 5 to 8% of carbon footprint, we have to take it seriously. Mm-hmm. And usually in any healthcare organization, laboratories are the most department that create waste, create plastics, create infectious materials, create collection tubes and chemicals that is really toxic and hazardous to the environment.
So what about the future then? What do you think we could look forward to in terms of further changes?
So I think the future is bright. If there is legislation on the agenda of the governments, if there is a real roadmap for us and for the suppliers as well, to minimize the carbon footprint. So alone, we cannot work alone. It's a complementing work between all stakeholders, from regulator to suppliers, to logistics and supply chain channels, to healthcare providers, to patients, and the most important, the government.
It's interesting you mentioned suppliers. I spoke to a chef recently, and he is on a mission to have London's first kitchen that has no bin. So his restaurant, he wants to have no trash, nothing at all. And he says one of the challenges that they face is educating those suppliers and saying, if you want to do business with us, then you need to be delivering your products in reusable containers. We don't want any waste coming into our kitchen. And I guess that must be an ongoing dialogue that you need to be having with suppliers to say, this is our priority, this is our agenda, and we need you to help support with that. Do you feel like the rest of the healthcare community is as on board with sustainability as you are, Dr. Rana?
Yes, definitely. I agree with the chef you met because most of our products we are getting in healthcare system and hospitals coming from suppliers. Mm-hmm. And those suppliers shall share the responsibility with us. The footprint and the carbon emission they are releasing in the environment based on transportation of their goods to us shall be regulated, shall be structured, and we are responsible to ask them what are the roadmap, what are the action plans. Not only this, we need to request them to supply us with the KPIs and metrics and how they did to the sustainability practice and for countries and governments. So alone, as hospitals and clinical labs, we cannot work alone. Definitely suppliers are requested and other stakeholders from logistics, from supply chain, they are requested to share with us their practices in order to have governance, in order to feel the responsibility at a global level.
Mm-hmm. Couldn't agree more. I think it's really interesting to hear, as I said, about all the hard work that you've been doing without us even realising. What would be your message in general then to any sector of healthcare that wants to become more sustainable?
My sincere message to everybody working in healthcare, all stakeholders, climate change is a global emergency and responsibility. As I said, it's not just in one country, it's going beyond the national borders. And the clinical laboratories and healthcare system worldwide needs to start defining environmental strategies and lead by example. And definitely they need to have more guidelines. It's already available to help them to achieve their sustainable goals.
Well, thank you for everything that you and your team are doing there, Dr. Rana. Really, really interesting to hear exactly what's happening. You are the head of quality at the pathology department at Dubai Academic Health Corporation, and wishing you and the rest of the team very healthy, happy, sustainable future ahead. Really do appreciate your time. Thank you.
Eye on Health
with MedLab Middle East
on Dubai Eye 103.8.